Okay, so for all you single nurses and nursing students out there who you don't have a roommate to practice your abdominal assessment on, I'm going to show you today how you can do that. Of course, you can pick a stuffed animal, but I actually have the best patient for you. Me. Yeah, that's right. I'm going to show you how to do the abdominal assessment using myself. So if you do have nobody who will let you practice on them, that was my situation. You do want to get good at actually doing the thing that you need to do to pass your test or to do your assessment on your patient. And so I am going to show you how you can do that with yourself and do an abdominal exam so you know the steps, the patterns, and what light palpation is, deep palpation, all in this video. Now, of course, stay till the end because there will be an NCLEX question that you can answer based on the information covered in this video. Are you ready to get started? Welcome back. My name is Tammy and this is NurseMinder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Assume that your subjective data gathering is already done. You know the questions about how long has your pain been there, what triggers it, those kind of things, any past medical history. All of that is already done and we're getting into the assessment. 3 things we're going to cover in this video. The first is just the basic foundational stuff you need in order to go into your abdominal assessment. The second is I will show you the abdominal assessment using moi. And then the third, we'll talk about a few special tests at the end of this video. And of course, stay tuned for the NCLEX question. So let's get started first with some of that foundational information that helps us pinpoint what might be going on with our patients. All right, so one of the first things we need to know is the anatomical locations of things. And so we have a thing called the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. That's probably the most common that you're going to hear in nursing, but we can also have the epigastric, the umbilical region, and the hypogastric or the suprapubic region, just so that if you're hearing these terms, you kind of know what you're looking for. And then we're going to add even more. So if you want to get a little bit more specific about what you're looking at, we have the right and left hypocondriac regions, the right and left lumbar regions, and the right and left iliac regions. Now, what I like about this diagram with the 9 is that it actually shows you where you would find the different organs, such as the liver, the spleen, the kidney, those kind of things, and the bladder, right? And so when you're giving your information, you can be very specific about the region in which you found an issue. But I don't want you to be fooled by this. All right, so we don't want you to be fooled into thinking that if somebody has pain in the right upper quadrant, it's related to the liver. In fact, we know that the abdominal cavity is very generalized in terms of where it will refer pain. So, for example, the gallbladder will refer pain to your back. And so just making note of where the organs are within the abdomen cavity is all you need to know for now. Okay, confession time. How many of you, and let me know in the comments below, have had to practice your abdominal assessment on a picture, on a pillow, on a stuffed animal, because you had nobody available to help you do this? Let me know below. And what I'm going to show you next is I'm going to show you the abdominal assessment on me. So I'm going to use my body as the demo and my hands as the instructor or as the nurse doing the work. So this is another way that you can practice your abdominal assessment should you not have anybody there as a live patient to practice on. Now, when it comes to the abdominal assessment, we're going to jump into this video assuming you've already done your subjective questions. So you've asked them what their chief complaint is, you've asked them all the questions around their PQRSTU for their pain assessment or whatever it is you use for that framework. You have also done a health history, a family history, a work history, a medication profile. All of those pieces are done and we're ready now to look at the abdomen. So let's get started. Alrighty, so the first thing we need to do is be able to see it. So you're going to have your patient lift their shirt or take it off if they're comfortable. And if you can't see the entire abdomen with them lowering their pant, you're going to have to ask them to undo it so you can physically see what you're looking at. Now, the first thing we're going to do is inspect. We're looking for color, hair distribution. We're looking for any lumps and bumps that might be obvious, surgical scars, moles, that kind of thing. And if surgical scars and lesions exist, you'd want to measure them. You also want to note if there's any hernias. You can ask them to bear down, and if there's any bulges, then you'll notice that there's a hernia present. And then lastly, don't forget to check the umbilicus and make sure it is midline. You might notice some pulsations here about the aorta. You may see the heart beating there. That would be normal in a thinner walled person. And you may see some peristalsis movement there, or if the patient is pregnant, you may see the baby moving. So that's all part of inspection. From the side, we're going to be checking to see the contour. So a scaphoid is where the abdomen is lower than the rib cage to pelvis line. A flat abdomen, we may have a slightly rounded, or we may have a protuberant distended belly. Okay, so after you've finished your inspection, we're going to move on to auscultation. We want to listen first so that we don't increase any peristalsis and the sounds that we might hear if we were to palpate first. All right, so using the diaphragm of our stethoscope and light pressure, we can start in any quadrant. Most textbooks recommend you start in the right lower quadrant. As long as you're hitting all 4 areas, it is fine to start in any section. I would suggest that you need to ask your patient if they have any pain first, because you would want to leave the painful areas until last. You will listen for 10 to 15 seconds in each quadrant, and as long as you're hearing some high-pitched bowel sounds, you can move forward. If you hear nothing, you'd need to listen for a full minute in each section. Next, we're going to go on to the bell, and we're going to listen for any bruits in the aortic, in the iliac, and in the femoral arteries. Typically, you should not hear any sounds of blood flow through these arteries. And if you do, you'd want to note that and share that information. All right, so we're just moving down to the iliac artery, which is just down below the umbilicus slightly, right and left side. And then to access the femoral artery, you will need to probably pull those pants down even a little further than what the patient has had for you already to get down further into the femoral. Now, when it comes to percussion of the abdomen, I find that it's actually rarely used in practice by nurses, but I'll show you the percussion piece here anyways and talk to you about the different types of sounds you should expect to hear in the abdomen. All right, so next we move on to percussion. So if you remember watching the IPPA video, we're going to do 2 quick strikes and release our tapping finger so that we can hear the sound. And this is a little challenging on myself, I must admit. Moving on to palpation, we're going to start again in a systematic approach. We'll assume that we have right lower quadrant, so we're going to start in the right upper. If you notice your patient's tensing, you may want to have them hold their fist like this and pull, and that will distract them so that it will soften the abdominal muscles. So again, right lower quadrant pain. So let's start with some light palpation in the right upper quadrant, and then we're just going to go in circles and move around the abdomen, noting any grimacing or comments or sighs from the patient. Okay, and as you go over that area where they said it was tender, you want to be paying particular attention. Then we move into deep palpation. So we're going to actually take either 1 or 2 hands, and we're going to go further down into the abdomen. So we're looking at a couple, 2, 4, 5 centimeters, and just check to see if anything for masses, lesions, any tenderness that's not obvious again. And when you get to that quadrant where they're tender, you want to just go slowly and just watch their reaction, okay? In the right lower quadrant is one of the common locations for the appendicitis. Well, it is the location for appendicitis. And so what we need to do is find McBurney's point. So we take the umbilicus, that's our landmark, and we're going to draw a straight line down to the anterior iliac spine. That's the front part of your bone here that sticks out. Right. And so what you want to do is, as you've drawn this line down, you want to stop at 2/3 of the way towards it. And that's McBurney's point. That's the anticipated location of your appendix. And so you're going to take your hand at a 90-degree angle, and as you press down, the expectation is that the pain is lessened if it's appendicitis. And when you release, the pain increases because that inflamed organ is now expanding. And so that would be McBurney's test right there. To check for the liver to see if it's inflamed or the gallbladder if it's inflamed, you're going to do the hook. So you're going to find the rib cage, press straight down and up kind of thing. And you can use like the side of your hand or the fingers. I find the fingernails can be a bit troublesome, so just use your palm there. Have them take a big breath in and release. Now typically you cannot feel the border of the liver. If it is enlarged, you might notice that. The other thing that happens is as they take a big breath in, if it causes sharp pain and they stop their inhalation, then that might be indicative of gallbladder. All right, so now that the assessment's done, let me know below. Is this one of those assessments that really got you stumbling in school, like you were struggling to figure out just how to do it in a systematic way? Of course, this is the one where we change our IPPA. If you watched the last video here about inspection, palpation, percussion, and auscultation, if you watch that one, you know that we've actually flipped this one on its head. We start with inspection, and then we go to auscultation, percussion, palpation. We kind of go from the top, bottom up. All right, my lovelies, there should be no reason why you cannot practice your abdominal assessment on yourself. I just showed you that I could do it for me. While I agree it is not ideal, you can definitely get the flow of your assessment down and some of those pieces. So if you've been studying and you've been paying attention, these NCLEX questions should be no problem for you. So let's head into those next. All right, so question number 1, feel free to pause this video. Your patient complains of abdominal pain for 3 days with tenderness to the left epigastric area. In what order will you complete your assessment? Okay, you've got your answer. You've paused the video. All right, so the answer here would be number 4, inspection, auscultate, percuss, and then palpate. Well done. Let's do one more question. Okay, so in this question, we did talk about a few special tests, so we're going to see what you remember. Your patient has acute right lower quadrant pain with a positive McBurney sign. What diagnosis might this lead to? Go ahead, pause the video, and we're back. If you said appendicitis, you would be correct. Well done. Thanks for watching. If you haven't subscribed already, please hit that subscribe button, hit the like button and the bell. You'll be notified when the next video is released. And when you subscribe, you're really supporting me and saying, you know what, the content you're making is of value, keep making it. That's really what I want to know, is that this is valuable to you. Now, if you have a nursing colleague, a nursing friend, a nursing student in your family, let them know about this YouTube station, because I have a goal to reach 100,000 subscribers in 2021. And that means I'm going to need you. I'm counting on you to help me get there. Awesome, guys. Make it a great day, and we'll see you in the next video. Hey, I know you're probably not ready to get off your phone or go back to work just yet, or maybe even turn the lights off to go to sleep. So why don't you spend a little bit more time here watching another video?